Hi there. Thank you for joining me for this video on massaging to relieve the knees. Like every piece of mind, body, spirit work that I do, I really find that we want to unravel, unwind the whole system. And so focusing on the knees to me means checking those points of fascial relation and thinking of the knees as the center of the work rather than the only place that we're working. And the difference there, right, is that when we work just on the place that hurts, we'll get a temporary relief, which absolutely can be important. I think of it as an Advil relief because we'll get a few hours, and that break can absolutely be exactly what we need. However, when we unwind around what's aching or stressed or tense or just calling for a little extra attention, then we get to really get more profound relief that can last forever, um, and more normally lasts until whoever we've worked on falls back into the patterns that cause that tension to begin with. So the knees are really great for Eric because he tends to hyperextend them, and so many of us do. We're told to stand up straight as children, and it's often not emphasized to us that standing up straight means with soft knees, and so we will straighten our knees, which is a little too much, too straight. um, so as always, if you have any questions, please feel free to drop them in the comments. I will be live with the premiere, and I'll be checking back after this airs. So if you have a question at some point in the future, please feel free to share that as well. So I'm going to start by just checking on the alignment between, or the line between Eric's knees and feet. And I can see when I look here that his feet are everted or pointed out. And the bolster, that pillow that I use, is under his knees, kind of supporting them, which you want to make sure to do. The bolster is really nice because it's a round pillow that fits that curve really well, but any pillow will do it. And especially when you're working in the low body, but really when you're working anywhere because it's all connected, right? You want to have that pillow in so that your low back can relax. Because if you don't have it in and the legs are very straight, they actually end up being hyperextended, just like when we stand and we straighten our knees. And that can cause tension in the low back, right? So when I see that his feet are everted like this instead of just a little bit straighter, it's normal for our feet to kind of move out or in when we're in this relaxed position, but it does indicate that, to me, seeing an inversion that, or an outward pointing that is so pronounced, suggests that there's something happening in the hips, where the hips are kind of tilted out, because this carries all the way up. And with hyperextension in the knees, that makes a lot of sense. So we're just gonna start, or I'm gonna start by lifting, and I'm lifting his feet, but I'm making sure that his knees still have that bend. So I'm not straightening them all the way. And while I'm doing this, I'm putting pressure on the inside of his heel to gently straighten his feet, to just kind of help moving the body toward where I want it to be. I really believe that the gentleness is what's sustainable, right? We don't want to be too aggressive because that just adds tension back into the system ultimately. So now I've Gently encourage the feet by pulling them up. We've lifted them. This helps the hips release, which helps the lower legs release. And again, I'm turning them and gently straightening them. And I can see as I straighten them that his feet are actually turned. So I'm looking at his left foot right now and seeing that it's slightly, the foot itself is turned as well as pointing out. It's turned toward the outside, which suggests a walking pattern of a little heavier on the outside and speaks of a tight muscle in between the knee and foot along the shin. So right in here, in this area. And it is happening a little bit on the right side, but it's happening in a more pronounced way on the left. So I'm gonna start by, and I'm just gonna pull this up a little bit so maybe you can get a better line of sight on what I'm doing. So I'm going to start by putting my right hand on top of his knee, and I have oil on standby because when we're working skin to skin, if we're going to do any kind of gliding, you want some kind of lubrication. Otherwise, you're pulling on the skin in a way that could become quickly uncomfortable. But a lot of this I'm going to do without oil, and I may not use any at all. So I just have it there in case I want it. So I'm going to brace with my right hand on top of the knee, not on it, but like right above it, where those quads and thigh muscles come down and attach right along the top of that kneecap. So my thumb is against that, but the pressure is going in the heel of my hand into his thigh. And I'm going to use this as a pivot to move his thigh back toward the center line, that midline, while holding the foot toward me and gently encouraging it to straighten into a line. And then we just check in. So how does that feel, Eric?
Very good.
In terms of intensity, where would you say you are on that 0 to 10 scale?
1 or 2, very light.
So it's really not a lot of pressure. It feels very good. He's relaxing. And if he's relaxing, that means that his body is relaxing, right? And that's what we want, is that unwinding effect. It really, our bodies are so amazing. And I say it all the time because I believe it. And just having this unwinding can really create profound support. And so I'm just holding and straightening. Now I'm going to follow this line down of his shin, and I'm going to lift. So I'm just using my fingers to gently lift along, right? Any bony protrusion, any place where bones are sticking out naturally, not because of an injury, is a place where muscles, tendons, or ligaments are attaching. And so I'm using this bone that sticks out as a starting point on this side, and I'm just lifting with my forefingers with some gentle compression, probably like a 2 or a 3 here.
A 2.
While I continue to straighten the foot below. And lifting. You just saw me straighten up because I realized I wasn't comfortable, and so I'm dropping into a better posture for me because I can only help Eric as much as I can help relax myself, right? And so I'm just following this all the way down to his foot. And our knees are such a busy place, right? We have bony protrusions all around our knees, from our thigh, from our shins. It all happens here, right? So from our femur, our ilia, tibia. Okay. So I followed that down, and this foot is looking much straighter, much more relaxed. And this whole area there's a little bit of red coming to the surface on the opposite side of where I worked, which just shows an increase in circulation, which is great. And the overall tension has decreased. So now I'm going to go to this side and just check in. It does have a little bit of that turning, but not, like I said, not as much. But we always want to work. I always like to work side to side just to get that balance, because I find that discomfort really happens more when things are out of balance than when things are tight. So again, I'm going to brace and move in. And I'm just straightening the foot gently and trying to get it on camera so y'all can see. Just encouraging it to release and relax. And I see that on this side, there's really a pull from the inside of his foot here up to the inside of his leg. And that's really where the pull is coming from. So I'm going to again find a bony protrusion, and I'm just going to work with it and work on the fascia, that connective tissue that is restricting and maintaining that tightness between the knee and the foot. So it's kind of like working with a saran wrap that's covering everything, just in terms of, like, you know, if you're too aggressive with saran wrap, it'll crinkle up and you just can't do anything with it. It's the same thing, kind of thing with fascia. You want to be gentle and just think about spreading with a very relaxed kind of pressure. And now I'm going to go back in and just see where I'm at. And it looks pretty good. So I'm going to just lift feet again and check in. And I see that there's a little bit of unevenness here still. But the turnout is happening on the left knee rather than on the foot. And so that tells me to look at the hip or the upper thigh. So I'm actually going to work through the blanket here. I'm going to pull the blanket down because I think that's going to be easier to see. And then I'm going to, is that temperature still okay?
That's good.
Okay. And then what I'm going to do here is, again, I'm bracing above the knee. And this time I'm working on, so our IT band, right? You're probably familiar with that term, is our iliotibial band. It attaches above and below. And where it attaches, it like turns into this combination of muscles and ligamenture, right? So where it attaches below by the knee here is often, right, it's one of those bony protrusions that we can work with, and it's often a hot spot. I'm actually going to be lifting because it looks like Eric's left hip is back a little far, which can come from crossing legs, combined with the hyperextension of the knees when you're standing, they kind of interplay. And so what I'm going to do is lift up on his hip on this side. to just kind of encourage it to where I want to go. And to get that fascial play, I'm going to put some pressure and some gentle cross friction, cross fibering on the lower attachment of the IT band, and everything else that attaches in that area. And I'm going to do it with my thumb on this side just because that's what's easier for me. So I'm going to lift and Eric just took a deep breath, which is another sign of that somatic release. So when you see eyes fluttering or deep breathing, any of that stuff that we do unconsciously just shows that the body is deepening its relaxation state. So now I am just going down the IAT band. And doing some cross fibering while I continue holding at that lower attachment site where it attaches to the tibia. All right. And so now I can see that the hips are more even. And a great way to assess that, and you will be able to just tell with sight like the way I can after you practice a while. But just putting your thumbs onto the hip bones and using a combination of palpation or touch and sight will help you see how even they are. And what it's also telling me, right? So palpation is always good. This kind of assessment is always good no matter how experienced you are. It's also telling me that as well as being this hip was depressed, well, the right hip is actually also raised. Right? They're playing back and forth with each other. So I'm just using the heel of my hand to put some gentle pressure onto the hip, onto the iliac curve here. And so just gentle pressure out and down. Maybe I'm at a 3.
About 3 or 4.
3 or 4 on that 0 to 10 scale, which is about as high as I want to go because, well, I never want to be above a 7 because that definitely people are tensing. I like to work, the longer I do this, the more I like to work at the bottom of the scale, just to encourage that systemic relaxation. So while I push down here, I'm also pulling back on, again, that lower attachment site. And I'm not putting pressure directly on the kneecap. My hand is on it, but I'm only putting pressure in with my fingers. I'm not putting any pressure on the kneecap. I'm gonna be careful, right? You can move the kneecap around. It's a mobile joint, but you don't want to do it aggressively. You just want to do it in a nice, relaxed way. All right. So now I'm going to reassess and check back in. And it looks pretty good. And so I'm going to check back from the base as well, and also get an eye on that head to toe line. his left foot looks like it's turned out a little more again, but I'm going to straighten him with that lift and pull and just see what happens. And I'm going to check the outside of, so now I'm working both of those attachment sites that I've been kind of focusing on incidentally in this video. And I'm just gonna feel around to see what happens with balance in them, because I do feel a little bit of tension on that tibial tuberosity. And I'm going to follow it down into his ankles to see what's there, and then back into his feet. Really, the more you palpate, the more time you spend just feeling and gently exploring, the more clear things will be to you. And so I found a bit of tension just on the inside of his foot here. And remember, we worked on the inside of the shin on the other leg, and this leg seems to be calling for just a little bit of it. And there we go. That was enough to make him balanced in this line between foot and hip. And these strokes are just some nice glides I'm doing on top of the sheet, which feel good and also give me one last chance to do like a quick passing assessment as well as some closing strokes and just feeling those muscles that I've worked with. And closing up. Thank you so much for joining us for this video on the knees. I hope you find it really helpful, and I love you. I love me. I love us. I'll see you soon.